Will be speaking. I'm so sorry about that. She's a clinical assistant professor of psychiatry at the Stanford University School of Medicine. She is director of the Muslim Mental Health Lab and Wellness Program and the co-director of the Diversity Clinic. She pursued her psychiatric residency training at Stanford, and she also completed a postdoc clinical research fellowship with the National Institute of Mental Health. Yes, I do. Her research and clinical work focuses on the mental health needs of Muslims, and she's also the clinical director of the San Francisco Bay Area branches of Close Center. So let's give her a warm welcome, and then I'll...
Okay. All right, is this working okay? Yes. Assalamu alaikum. I'm going to apologize ahead of time that my voice has just come back. It was gone for a few days, so bear with me. I'm sorry that I sound like a adolescent boy. All right, alhamdulillah. It's really an honor and pleasure to be here. Thank you, Sarah Moore. It was a wonderful presentation. And thank you for kind of cueing in the next subject here, which is really a book talk on Islamophobia and Psychiatry, which was published in February of this year by Springer. And really what we want to accomplish in this particular talk is just let you all know what all the different research that went into this book and how it all started. So from there, we'll go to the next slide. A lot of the work of how we were, myself, there are 4 co-editors for this book, and how I was pulled into it was because I direct a research lab on Muslim mental health issues at Stanford, and a lot of the research, at least from the ones that I supervise, come directly out of that work. So just letting you guys know that that's a resource, and you're welcome to visit the website to see what all we're doing there. Okay, so the book started off because a couple of years ago at the APA, the American Psychiatric Association annual meeting, there was a presentation on the topic of Islamophobia, and it was really interesting. There was I guess an editor of Springer who was sitting in the audience and thought that the panel was a really interesting panel and wanted to form it actually into a book. The folks that were on that panel, you see Dr. Steve Moffitt and Dr. John Petit. Dr. Moffitt's from the University of Wisconsin, John Petit's from Harvard. And then the two, so it's very interesting because it's a very interfaith kind of collaboration. Dr. Moffitt is Jewish, Dr. John Petit is Christian and represents Christian psychology and psychiatry. Dr. Ahmed and myself are the Muslim representatives essentially on the book. And he's from the UK, I'm from the US. And so we kind of did a very broad, different spectrum of age groups and perspectives that came into this book. So I'll show you guys a couple of basically the next few slides are really just what the actual contents are. So just the way we start off is we talk about the Islamic Golden Era and how there was a lot of advancements in terms of mental health in that era. Those of you who've heard me speak know that I really enjoy this topic and probably could take up the whole time talking about all the different advancements of mental health. And I do have a slide that comes up later where I'll touch on it a little bit. But I thought it was a really befitting kind of place to start the book of explaining where the Islamic origins really of a lot of what we today would think of as Western psychology and mental health. There's a lot of origins actually that come straight out of the Islamic tradition and amazing advancements. So I really welcome you to take a look at that particular chapter. And then Dr. Hatem Bazian, for those who know him, he's the director of the Islamophobia research study at UC Berkeley. And he then writes the introduction to what is Islamophobia, all these different decades of research that has gone into the machine called Islamophobia that essentially pumps out, multi-million dollars worth of work that essentially smear campaigns of Islam. And he does a really great job of explaining what its origins are. He actually traces them all the way back to Oriental times, essentially, Oriental writings. The early 1800s is actually when the word Islamophobia was first introduced into literature. And he just shows, it kind of tracks how it has gone through all of this time. Then from there, we go into, as you see here, and I'm not going to read it all to you, but we have, I just want to point out how the authors are really key authors. You see, for example, Dr. Harold Koenig is on here. He is the head of the Duke Religion and Psychology Research Initiative. And so we have different faith folks working on this book, all kind of trying to bring up really key understandings of how this formulates into our understanding of Islamophobia. It's not just written from the Islamic perspective. Next slide. In fact, if you look at some of the, you'll see here, it's like, you know, and Iman Musa's in the room, as is Dr. Sarah Ali. There's several people in the room actually right now, and in the conference in general, who are actually authors of this book. So it's kind of exciting that they're all here. But just to show you, like we have from the American Muslim perspective, British Muslim, and then you'll see this whole section where it's like from the Christian perspective, from the Jewish perspective, from a, you know, so it was really nice to figure out what other folks, you know, clinicians and other faith groups, what their thoughts were on Islamophobia and how it impacts the folks that we all work with from the Muslim community, because the reality is we're all sort of impacted by this. So this is just a few more kind of understandings, so we'll go forward. Thank you. So here I just wanted to kind of give the next several slides are just kind of like little snippets of things that are happening in the book, just to explain what some of the research findings were. So there's a section here where it really talks about how Islamophobia is winning and how, you know, everything from the Patriot Act and looking as far back as the executive order, you know, the Muslim ban, right, which we term the Muslim ban, that they may call protecting the nation from foreign terrorists entering the U.S. And also all the studies that have come up by CARA, the Council on American Islamic Relations, that has really showed the direct impact of Islamophobia on our youth, on our children, on adults, on jobs, and how it really has led to anxiety in the Muslim community. The reason we really wanted to put this together is because every time somebody tried to write a grant or a research paper and tried to systematically, with evidence, prove that Islamophobia actually causes depression, anxiety, or other post-mental health concerns in our community, there was no actual research that you can point to that was published that was quantifiable, where you could say this is real. Islamophobia really does affect our community. So this was the attempt, essentially, on doing such a thing. This is actually taken from Dr. Sarah's chapter, Dr. Sarah Ali's chapter. She and I will be presenting a little later today on community engagement with the Muslim community. And one of the things that's highlighted in that particular chapter is how, essentially, there is this, you know, varied level of how Islamophobia affects each and every one of us. All the way from an individual kind of perspective, you may or may not have been bullied, you may or may not have dealt with a hate crime based on your religion. But even if you haven't, you're going to find that somewhere along the line, it actually has affected you in some way. Whether it's in the policies, or whether, like the Muslim ban, for example, or whether it's in the centers that you worship in and you partake in, surveillance. And I think Kara just published her research on how you know, a lot of mosques are continuing to be having surveillance, essentially. And when the government shutdown happened earlier this year, they suddenly couldn't continue some of the surveillance tactics, and it became even more clear that mosques are being surveilled. So it just, you know, mashallah, there's a lot there that's happening, and it affects each and every one of us in some way. For some, it's all four, and for others, it's just one or two of these sort of interconnected circles, concentric circles. And then in terms of the stats, I think it's really useful to see numbers. And so when you see hate crimes and you see that pre-9/11, you're at 28. And by the way, these are reportable. Kara always reminds us this, that these are the reportable number, or the reported numbers. When in reality, it's probably multifold, because so many of us, I mean, I've actually had this happen to me where something happens, somebody yells out something out the window, and I'm like, I'm not gonna put it on, you know. Although Dr. Hassan Bazian will tell you there's a Islamophobia app that you're meant to actually report everything on. And I'm like, and he was like, come on, because I'll offer the Islamophobia. So, you know, I'll start with myself and say that I have, you know, have actually neglected. So imagine these numbers are from folks who, you know, were willing to actually go ahead and go through reporting. But to see that spike, and this is 2001 when people are like, oh, pre-9/11, you know, 9/11, that's the big, that's kind of like the big Islamophobic sentiment that happened. But in reality, if you look at the numbers that continue, after the presidential election season that started in 15 and into 16, you're seeing a 70% spike, and then again another spike in 16 after inauguration of another 26%. So when the numbers start to show, you see that it's like it peaks at 9/11, it kind of stabilizes, and then it really peaks during this last few years. The youth. So really, one of the main important things that happened here, and I'll point you guys to the very bottom here of the CARE study, was essentially showing that 53% of respondents said that they have received physical or verbal abuse in schools. So when you send your kid into school, or your future kids, I know there are different ages in the room, into school, there is a 50% chance that kid is going to be bullied because of their faith. Whether it's their name, whether it's what they're wearing, whether it's they're eating differently than other people, whatever it may be. And that's a really high percentage to realize what we're putting our children into, considering that we feel very much part, and need to feel, very much part and parcel of the fabric of the society, but knowing that it's always going to be we feel left out and we feel different. So just really wanted to point you in that direction as well, and the whole report is on CARE's website. So, the research that starts on this probably starts somewhere in the early 2000s, where people started documenting the effect of Islamophobia on our community. And, these kind of symbols, in fact, we drove here, and we passed through Anaheim, and there's a really cute masjid, little tiny masjid on the side of the road. I was like, oh, nice. And then as we were driving, I was like, is that a swastika? And so the reality is this is, maybe your own home masajid have this on them as well. But these signs are very much part and parcel of what we deal with on a daily basis. Here, of course, is one of our success stories of the last couple of years. I feel like, for those who believe that Barbie is successful, I'm really proud of Tihash. I'm not too sure about the Barbie, but I'm really proud of Tihash. But I do have to say, the Barbie is not actually in Barbie form. Did you guys know that? The Barbie is actually much more muscular, and the frame actually matches her own body, Tihash's body, which is much more of an athlete frame, right? So just FYI. And it is, it comes in her fencing outfit, but also comes in her fashionista designer outfit too. So when this first came out on Facebook, I was standing there like, oh my God, look at this. So my daughter, who is, 11 now, was standing next to me. I guess she was 10 then. And she was like, oh my goodness, is that real? And I was like, yeah, sure. And I was scrolling through, and next slide, this shows up on the feed on the very next, picture after. And I was like, oh, okay. My daughter was like, oh, I was like, nothing at all. Nothing at all, you don't need to see this. So, it's just the comments that even when we feel like we're celebrating our successes in the community, this is the eventual, the trolling that happens online. So these are just signs, just pictures. Some of these are actually from our airport in SFO. And I think the reason I want to put these up here is because after 9/11, we really did not see, things that basically say, we are all Muslims now. I mean, these kind of messages were definitely not around early on. So when people say, well, there was Islamophobia, there's Islamophobia, it feels different today. And the silver lining, and I really want to point you to all of this, this wonderful study that the Pew's research study did, where they basically figured out all the different faith groups and figured out which was the most hated. Unfortunately, Muslims and Islam was kind of the least. But when they figured out from those who did not pick Islam, what caused them to not pick Islam as being their least favorite religion, so to say, it was the one main factor was personally knowing another Muslim. Personally knowing a Muslim. And I think that's where the silver lining is, where our community is doing a whole lot better and actually getting out there, being less insular. I think we'll find that Islamophobia eventually has a decrease once we are more likely to get out there and actually be able to show who we are and what we're all about, right? So, need to put the silver lining. Now, a couple of slides like I promised about the other parts of the book. For example, we talk about in that first chapter on the effects that come from Islamic history, and how Islamic first hospital systems that actually had a psychiatric ward, and the first psychiatric wards themselves happened in the Muslim lands, which I think is really noteworthy and important. I have here on the bottom here the original research that Dr. Sarah and I had wrote about on Abu Zayd al-Balkhi, and how he writes in really intricate detail on phobias, on OCD. And this is published in the Journal of Anxiety Disorders and the Journal of Affective Disorders. We focus in the chapter as well, but really to show and to highlight our own heritage and our own work in this vein. This is another research study that I also quoted in the book that talks about, this is in the Journal of the American Journal of Psychiatry, the Green Journal, where it talks about during the time of the travel ban, and it highlights a specific student, actually one of our Stanford students, who was directly affected by the travel ban. And I won't read the whole clinical vignette to you, you can hopefully access this yourself, but what I really want to highlight is something very key that she said. She said, I'm an immigrant and I'm a Muslim. And these four things caused me to be, despite everything I've done, and despite pulling myself up by my own bootstraps in this country, I'm still targeted and I'm still stuck by this travel. And so we kind of highlighted this in the Green Journal and also highlighted it in the book on the direct impact Islamophobia has from the policy levels directly to our community members. So, all of you know this, I'm sure, but just our crisis, and we talk about the different kinds of things, different chapters deal with acculturation issues, generation gap issues, culture shock, and acculturation issues. Iman is now back in the room, and she has a chapter on that specifically in the American Muslim perspective. But I just wanted to highlight what some of these other chapters are. Thank you. And the need for services. So another one of the main things that we do in the book is we tie in what Islamophobia directly affects. So we have everything from the job terminations and verbal abuse and unequal treatment and denial of access to public facilities, for example, and show how that directly impacts the life, the everyday life of the folks that we help and attempt to work with. The book is written for psychologists, psychiatrists, social workers, therapists, really trainees, all people who work with mental health, and it's not written for a Muslim audience. It's primarily actually written for a non-Muslim audience, for those who work with Muslims in their clientele and how it is to help and understand where they're coming from, to bridge the gap. The student that I mentioned earlier, one of the main things that came in that discussion with her, when we asked her, well, you have this clear PTSD trigger, she had a history of PTSD that was re-triggered by the travel ban. And when we asked her, what about therapy? Her response was, I've tried, but I had two therapists. And one, the reality was, I felt like I was educating them about my faith. It was just too much. The gap was too wide. I just could not fill the gap. And she just sort of gave up. And the second therapist, she said, was just like much better, but overpowering empathy, like too much pity. Right? And she said that was not useful in therapy, so she gave up and quit both and had a really hard time finding a therapist that could actually, it had the gap kind of closed, and it wasn't just offering pity, but actually constructive therapy, right? And so that continues to be some of the barriers for service, so that people want to feel that their concerns are addressed from an Islamic viewpoint, somebody who actually knows. And unfortunately, it's a parallel session with this one right now, with Dr. Haman and Dr. Fahad and them are actually talking about the Islamically integrated model of therapy that the Khalil Center is offering. But also the second is hesitancy to trust mental health professionals, whether they're Muslim or not. Just this idea of confidentiality is still very young in our community and very, is not very understood well enough yet. So we end up with a public health gap, and there's a lot of mistrust and fear. A lot of fear of the racism and discrimination that we spoke about earlier, but also the differences in communication and differences in religion and culture. Really, can a person really close that gap and make that therapy experience useful? Help-seeking attitudes in this idea of seeking out imams as first responders, which is why yesterday in every single conference, I don't know, mashallah, for the last, I don't know, Mary, maybe you could tell us for the last 5, 6, 7 years, they've had imam trainings on the first day of the conference because of this first point. that for many, not all, but for many members of the Muslim community, the very first person they'll go to is the imam, right? And the imam is not necessarily trained in mental health, as all of you know. So there's this thing of like, can we each be in our own lane, or do we sometimes overlap? Because both do counseling, but are they actually trained to be able to do, to know when to refer to professional care and counseling? But the reality is they still end up going to the imams before us. At least this is what research shows right now. Maybe this will change. And all of you, I'm sure, are very familiar with these concepts of the jinn and the evil eye and magic, black magic and such, that people tend to go to religious healers instead of going to clinical. So just a highlight of all of those issues, which we also do in the book. And then, kind of wrapping up here, we also talk about the cultural sensitivities that, and I think these points are really interesting for people because non-Muslim practitioners, when they think about what the eye contact means, because in the mental health status exam, you end up getting not making proper eye contact as being a sign of potential psychosis or potential depression or so on, when in reality it might be a cultural or religious, and so on and so forth. So I won't go through this whole list, but just highlighting some of those sensitivities. We also have, like I mentioned, Dr. Koning is one of the authors of the book. Some of the key leaders, Koning, Pargament, Larson, those who have written on the topic of religion and psychiatry, or religion and psychology, spirituality. And it's not just coming from a Muslim tradition, but I feel like we're now adding our voice to that discussion. That's been happening before us in the Christian and Jewish sectors. I love this little image here, and just say how, this is part of our problem. People feel like psychology is so foreign to them, and when you don't have a space to be able to put religion into, when God, you have God with you all the time, and you walk into your therapy space, and you have to kind of check God at the door, so to say. It's a really difficult thing for people, where they feel like that this is my source of healing for some, but I can't actually bring that up in a secular space. So we discussed this a little bit as well. Really quickly, the unconscious bias education is something that's in there. We really highlight and want people. There is, as you all know from the Harvard implicit bias website, one of the many that they offer is one specifically on Muslims and Arabs, and I really recommend people actually take that. Last semester at Stanford, I taught to the undergrads a course called The Psychology of Xenophobia. And all the students who signed up for this class, as you can imagine, are all like our social justice folks, which is awesome. But I had this, one of the assignments was that they do the Harvard implicit bias test. And some of them, they chose whatever they wanted to choose, but the class highlighted Islamophobia, so many of them took that. And it was really funny, they came in the next week and they said, we thought that we are the folks that are going to be the most neutral and the most, and they were surprised that when they took their own implicit bias test, that they had bias, unconscious bias themselves. So it was a real learning point that we all carry unconscious bias, even when we think we're neutral or we're pretty good about it. And lastly here, I just have one more slide. This is something Dr. Sarah and I and different people of the Muslim Mental Health Lab will actually talk about this. I think our lecture's at 3, right, Sarah? Later today. We'll talk about this a little bit more, but it's some really great research that came out of what does the Muslim community actually need or want. And it came out of focus groups in which we had women, men, youth, and imams. And the imams were like herding cats, trying to get imams in the room to ask them these questions on mental health. But we finally succeeded in doing so. And we'll highlight some of that research later today. But it's really interesting to see the same factors that keep coming up over and over again of what does the community actually want when the community speaks for itself, as opposed to us as professionals trying to research them. What happens when they speak for themselves, right? So that's what our topic will be about later. And there's a chapter in this book as well about this topic. And so with that, I welcome you guys to take a look at the book. It's up here, and my contact info is up here as well. You're welcome to let me know if you have any questions. Thank you all. Yes.
So my question is, I actually discussed this with a colleague yesterday, and my personal experience with therapy as a Muslim woman of color has been very challenging. Finding an appropriate therapist is the #1 challenge, aside from insurance and all the other transportation and accessibility barriers and whatnot. But one thing that I've noticed across the board in all the different types of therapists I've gone to a white Christian woman who was an interfaith chaplain. I've gone to a South Asian Muslim woman who wasn't necessarily identifying as Muslim. I've been to a Persian, I don't know if he identifies as Muslim, but he would say salam to me, older gentleman. I've been to an Asian woman who I don't know her religious affiliation. And across the board, it's been, they have all, I'm sure, in fact, I know for a fact one of them had cultural competency training, also racism training. They've all kind of been exposed to this concept of educating themselves in what it means to be a culturally competent professional. That gap you were talking about, I find is still very prevalent with many of us. And unfortunately, even though that cultural competency aspect, excuse me guys, no worries. Unfortunately, even though that cultural competency aspect can be studied, it's very far from being understood from a lived experience perspective from the therapists themselves. And so I think, I'm wondering what you have to offer in terms of maybe perhaps what I could take back to my own therapist, or just generally for the professionals in this room. What does it mean to implement cultural competency from a perspective that you're blind to because of your own, from a perspective that you're blind to because of the fact that you have a position of power, or maybe you're just not a part of that community. So what can professionals do, and then what can clients do?
I think it's great questions. Some of the main trainings that we do, would you mind going back to the slide where it's just to show you, like, and you're right about the lived experience, and sometimes there's only so much you could really do without really literally going into that person's life. But there's one more slide earlier, right here. This is actually a training we're doing for all of our clinicians at Stanford, and all the residents, all actually like hospital-wide. And this, I'll just share with you real quick, this Rania one. Because it's really interesting, because what a person may do is come in initially with all these assumptions and say, oh, I think I have a little bit of information here or there on the topic. And it turns out that after a while, because the resident eventually thinks that, or because of his name, thinks he's Muslim, and thinks because he's hearing voices, this must be some sort of psychosis, wants a psych consult, right? But as it goes through the actual scenario that the residents are taking as module learning, it turns out that when she is asked by her attending, why did you ask him what the story is? And they're like, oh, I'm not trained to really ask about religion or ask these kind of private questions. But in therapy, as we know, we ask all kinds of intrusive questions, very private questions, and this should be part of the process too. But for many, it's not really. And so anyway, she finds out he's actually a Jehovah's Witness. And when he says, I'm hearing God speak to me, it's because from his church, they speak to God and they speak in tongues, and they're able to actually have that one-on-one communication, and it's not at all a sense of psychosis, nor is it still in the first place. So the whole module goes through to really so part of the answer is training, right? And you're right, as much as you may read or as much as you may train, it's very different than being in that those shoes specifically. But I'll tell you something, we, with our residents, I just finished a course in the winter semester, I teach a course on culture and religion and psychiatry to our psychiatry residents. And in every single semester, there's at least somebody who's like, do we really need to take this again? You know, they feel like they've already been trained enough. Yeah. And there's at least one person who will raise their hand and say, but I don't have culture. You know, I'm serious. I'm serious. Excuse me. And it's just really funny. And then I say, but if I pick you up and I drop you in like Ghana, do you suddenly have a culture? Right. And I'm like, oh yeah, maybe I do. You know? And so we kind of put them in these situations where they have to like figure it out. You know, I'm like, if you're going to be the provider who's going to actually do this for someone else, you have to do it for yourself. We're going to actually do this to you. Right. So they actually take the DSM cultural formulation and get up on the walls and actually start writing their own formulation of themselves first. And that finally breaks the ice where they're like, oh, well, like this light bulb goes off, you know? Yeah. But the reality is, this is where we say, even if you do all of that training, which is really important, there's the other piece, which is, and so to answer your question, what can she do or you do, whatever the therapists do, they can do these trainings. But the other piece is they may actually need to do cultural consults, which basically means that you reach out to the faith providers, the cultural, consults in the community, and actually have them guide you through what are the issues this person is dealing with, because I simply don't know, right? So the cultural humility to say, I don't know, and I need to figure this out to help this person.
Wonderful, thank you so much.
Yes.
I wanted to ask you more actually about how to counter this overly secular academic environment. I work as a research assistant in a psychiatry department at a hospital where I really want to apply for residency. It's close to home, it serves a community that I want to serve. But we were recently sitting in an open studio session, just everyone came in participating, and the associate director came in, and there was a religious sort of drawing that one of the therapists had drawn, but in a different religious practice. But this conversation started, and then he started speaking about, he started saying very dismissive things about religion in general. And I'm a practicing Muslim woman wearing a hijab, and everyone knows that I practice. And so he just sat there saying, oh, you're all intelligent people, why do you think there's a need to pray, you can reason everything out. And then he himself said something so hypocritical where he says, oh, when I'm stressed or I'm like a big exam or something, I would go pray, but I didn't mean, I wanted to say so many things, but I couldn't, I had to hold myself back because I also don't want to antagonize anyone. But it was such a difficult thing to sit through. Because he knows that I'm interested in applying and that I am practicing as a woman. It was just very belittling. And I wonder that if I do get into this program, I'm going to deal with not just him, but a lot more attendings who are kind of the same.
Are you sure that the law more attendings are the same? Here's what I want to say. Any program is made up of so many people, right? And the reality is he may be somebody who's very prominent. You're a medical student right now?
I graduated, but I'm
in between,
yeah.
Okay. He may be very prominent in like the medical school world or the non-yet psychiatry training world, but he may not be as prominent later. Do you know what I mean? So just remember that any faculty is made up of so many different people. And honestly, I think I couldn't have told you that unless I went through it myself, because I had some really very off-putting experiences early on. Some of you in this room have heard me talk about this before, but when I interviewed at the very place where I am now, when I told the story, but the person who, one of the 5 people who interviewed me for residency said to me, at some point in the interview, she said something like, so what are you going to do about that? And she got emotions to back up. And I was like, you read as a medical student, you read all these forums, they're going to like trip you up during interviews. I was like, okay, maybe she's trying to trip me up. So I was like, so I just try to like ask, what do you mean? And so she says something like, a therapist, she either said a mental health practitioner is supposed to be a blank slate, and you're anything but a blank slate. I was like, okay, so what do I do now? And so I tried to say, but if somebody from a different, background, African American, whatever, I tried to give some other explanation. And she said, he can't change his skin color, but you could take that off, right? And it was just very blatant, And so I ended up not even wanting to rank this program altogether because I figured that. But as I dug a little deeper, and the only reason I'm sharing a very personal story is as I dug a little bit deeper, I realized, and I started to ask around, is everybody like this? And there certainly is a segment of the department that's absolutely like this, but the others are not. And so you're always going to have people that are off-putting, and you're also going to have people who are supportive. And I would say this conversation is like almost, it's a long time ago. So, but now I feel like that it's really different. People are much, much, much more conscious about not wanting to say the wrong things anymore. Not always, but they're much more conscious, particularly the younger faculty. And the reason I actually stayed on to this very place that I trained and eventually became faculty of is because we ended up having a new chair. And one of the main things she said when she first came in, and yes, a she, which is fantastic, first said when she came on, she said, there's a lot of older faculty members here, with all due respect, older white men, who you know, are eventually going to retire and leave, so don't worry about them, Rania. And I was like, oh, you know, and really honestly, I felt that that's eventually what's happening. As time goes on, the face of psychiatry is becoming different. And I realize I'm in California, I understand you may be in a place that's not as diverse, but but in time, I think the face of psychiatry is becoming much more, you'll see this at least in a couple more decades, I'm sure is going to be the case. But anyhow, I just don't try to write off the whole program if you feel like it's really the place you want to be and it's the community you want to serve because of one or two comments, as much as possible. Do find the supporters. They'll be there. They'll be there. All right, guys. Sound good? Yes?
Do I have time to ask a question?
Yeah, so we have a 15-minute break now, so you're welcome to ask a question. We're going to have a keynote speaker in the main room. A and B will be turned into one big room, and that'll be a keynote speaker at 11:15. So we can ask this last question, and then we'll grab a snack.
Thank you so much for your talk. I read the book, except for like the last couple chapters.
My goodness, special.
I love it. It's amazing. It's an incredible book. I have a question. I have a couple questions. I have multiple questions actually, but the one that really and I want to say the book is amazing, and the book ends with this really like idealistic. The editor's comment is like, we want this to be a jewel, but you know, we've searched for buried treasure, and we want this to be a treasure, and that's like the last editor's comment. It is a total jewel, but the book is amazing. But I was really questioning your division of the last two sections. Why did you decide to put special clinical considerations with LGBT, working about African American, in one group, and then women, children, and adolescents in another group? That seems very questionable. I'm not sure what the thinking was, because it seems to me that women, children, and adolescents are also special clinical considerations. And the final section is community, and there's a few chapters that are specifically like really about community, but I don't understand that division. What was the logic behind that division?
Yeah, I wish I could speak to that, but I actually did not have a hand in the division of the chapters. Some of it was editor-based, and some of it was publisher-based as well.
Okay.
To be honest with you, the very last section, I think I myself had a little bit of a, hey, hello, what's going on here? But I don't think that was necessarily in our hands.
Okay, so it wasn't the editor, maybe it was the publisher?
Yes, the publisher had a specific kind of guideline that they wanted the book split in different sections. But I do think things could have been rearranged in a better way. I agree with you there.
Okay.
Yeah.
And the other thing I wanted to say was, what was your, can I ask you another question? Is someone recording? No. There's an amazing chapter on art in the book, and wanted to ask what exactly was, there's a little bit of comment on it, but could you speak to why you included the chapter on art?
The chapter on art or the actual artwork?
The chapter on art. The chapter on art is, I forget the name of it, art is spiritual practice or whatever it was.
I think it was just an effort to really get in all the voices possible into the book. And I think in that particular chapter, they also talk about the use of art in healing as well.
Right.
Not just art therapy in the traditional sense of art therapy, but also just the artistic experience of Islamophobia. That particular author also has a lot of the pieces of artwork that are sprinkled throughout the book as well. But it really was just to have more inclusive voices, more so than anything else.
Okay.
Yeah, I hope that's useful.
Yeah, that's it.
All right, guys. Well, I think we're at our break, so inshallah, I'm around at some point if anybody wants questions, any other questions, but we'll see you then. Jazakumullah khair. Assalamu alaikum.